Hello, KAWP podcast subscribers. I'm here today with Dr. Fadi Bacha, who is the medical director of the Anti-Aging Institute here in Lexington, Kentucky. And we're going to talk a little bit today about some of the new procedures in the world of anti-aging. Dr. Bacha, thank you for being here today.
Thanks for having me.
Listen, when we talk about anti-aging, that's a pretty broad topic. Can you tell me a little bit about what you do here at your business?
Well, a lot of people think of anti-aging as just mostly doing Botox and filler, and my concentration is completely the opposite. So I want to make you age gracefully from the inside out.
Okay.
Of course, the Botox and fillers are perfectly fine, don't get me wrong, and we use them plenty. But my more important aspect and goal of this practice is to how's your body aging process, and how can we slow it down, and how can we make you feel your best when you get to your 40s, 50s, 60s, and 70 and 80, and hopefully hundreds. There's a lot of variation that happen in our body, and we start usually feeling it in our 30s. Some people feel it more than others. So it kind of became personal to me when I hit that stage where I'm not feeling my best, and then start to research for selfish reason is what can I do to, still play soccer, keep feeling the way I felt 10 years prior. And that led me into the world of anti-aging. So I took a board certification with the anti-aging and trained with metabolism and nutrition, fitness as well, and start using it on my own, then on my family. I said, maybe my patient can benefit from that. And so that's why I opened up the Anti-Aging Institute. So we do a lot of things from maintaining your cholesterol, your blood pressure, diabetes management, obesity, hormone replacement, of course Botox and fillers if you need to, a lot of other procedures. I'm also always looking into what's new, what's cutting edge. So we are using a lot of plasma and stem cell therapy in our treatment programs, whether to treat arthritis, whether to get wrinkles in the face, try to prevent hair loss, treatment of erectile dysfunction. All those things that affect us as we age, I've tried to find a solution. I can't reverse aging, but I can definitely slow it down and make you feel your best.
Let's put a pin in the stem cell and the PRP, because I definitely want to touch on that. But I've got to ask you a question, and this is a question that I get asked from time to time. You're a physician. A lot of people have family physicians, but you just said that you got specialized training in nutrition, fitness, etc. Do you feel that just in general doctors have a good base in that, or is that something that you really do need to get some additional training on? Because I don't think that the medical schools spend a whole lot of time on preventative. They spend a lot of time on diagnostics and things like that, but not so much on the. Am I wrong?
No, you are absolutely correct. We spend no time actually on training on as far as nutrition, metabolism, and disease prevention. I am still a board certified in internal medicine and still incorporate that in my practice. But in the past, way we practice something, you come in, you have high blood pressure, I give you a pill for it.
Right.
And of course, along with the pill, I tell you, just go and do diet and exercise. So the patient will take the pill, but that prescription of diet and exercise doesn't mean a thing.
Correct.
And the doctor, me included at the time, did not have the time to spend to tell him what is the diet, what is the exercise, what you should eat, what you should not eat. Even if we tell him it's a quick, because at the time we're limited because of we have to see so many patients because of the insurance and what. As a practicing internal medicine, we did not spend too much time in those important factors, and we concentrate only on treating. And I noticed that in my practice, people 10 years, they started with one pill, then we add another pill, then they have this, and we added a third pill, and so on. And it becomes just a pill happy place, and the patient will just take the pill and go on. But we haven't done anything to see what can we do to stop this from happening? As a matter of fact, this has happened to me. So I start having high cholesterol running my family. So I say, okay, I'll take a pill. And then blood pressure started to go up. I'll say, okay, well, I'll take a pill. But then I said, I don't want to take blood pressure pills. My patient told me her whole thing about it. What can I do? So that's when I started getting into it. And then I got better exercise regimen. I changed my diet completely. I read, I got educated. I used to not believe in the word of supplement at all. I started some supplement, and now I do not take any blood pressure medication. And I just recently started taking cholesterol medicine at a very, very small dose. But compared to where my families are, I'm the one doing the best.
Right. Because genetically, we're all predisposed to certain things.
That's
Do you
right.
do any type of genetic counseling or testing here
Well,
at your?
there's really nothing that genetic modification that we can do, and there's not a specific genetic testing for cholesterols
Okay.
and diabetes, and it really doesn't change anything in the measurement. So we usually don't do that. So I can't change your gene,
Okay.
but I can try my best to, as I say, prevent you from going into those cycle where we're adding medicine after medicine after medicine.
So we put the pin in the stem cell and the PRP, and you are offering that here. So is that for more joint issues, arthritis? Do you do anything for soft tissue with that?
Yes. So PRP is a plasma-rich platelet. So we take your own blood, spin it down, and get the growth factors and the platelets, and re-inject it back at a higher concentration in areas where you have inflammation or degeneration.
Okay.
So we first started using it for soft tissue, found out it works great. We use it for joint injection, works great. Say, okay, let's expand it into a world of cosmetics. So we use it for hair loss, and it does work great. We use it for facial rejuvenation, works phenomenal. Recently, we use it for erectile dysfunction, if you heard of the P-shot.
Yes.
So it works very well as well. Now, stem cell is still a debatable subject. So there's no FDA approved stem cell protocol, and nobody using a pure stem cell in the United States. Outside the United States, I can't speak of that, but inside the United States, most we do is use a stem cell concentrate. So in other words, we can take a bone marrow concentrate and inject it, or we can take a fat from you, concentrate them and inject them in you. But the FDA hasn't given us the guidance on if we can really separate just the stem cell by themselves and inject those. Also, we are using embryonic stem cell. Those are donated embryonic tissue by parent for these treatment protocol, and we can use those. They're usually washed out from any DNA material, so they don't have any risk of allergy or causing an immune response. And we inject those. Great result in joint injection and soft tissue. I give you an example. I had a lady that was scheduled to have a surgery on her elbow because of a tennis elbow.
Okay.
And she was battling for a long time. She took cortisone shot, physical therapy, nothing worked. So the physician told her the last thing you can do is do a surgery. She read about PRP, so she came to see me about PRP. And I told her, I can't guarantee you anything. That's nothing, that 100% established. FDA has not put a clearance on those, but it's definitely worth a try. The good thing about it, they are extremely safe because it's from you back to you. So there's nothing to lose. So we did a ultrasound guided injection in her epicondyle, and I told her that it's gonna take about 8 weeks because it's not a cortisone, this is not a lidocaine, it doesn't have an immediate effect. It takes time for these platelet and the healing factor to do its things. So she told me yes. So we injected her. I followed up with her in 2 weeks. She said she's still having a lot of pain, and she's gonna go ahead and schedule her surgery. I said, okay, but you may want to give it a little bit of time. And I haven't heard anything from her. And a year later, she comes into the office to get some Botox. I said, oh, by the way, how did that surgery? And I was looking at her elbow, and there's no scar. She said, you know what? I canceled it. He said, by the time for surgery came in, my elbow feels fine. She was moving perfectly. I said, well, that's great. My wife had the same thing. We did the same thing to her. Amazing result. So all these anecdotal reports. So there's not, you're not gonna find a controlled randomized placebo trial on people with a lateral epicondylitis or tennis elbow, where they inject them with PRP versus steroid versus placebo, to say that yes, this is the treatment. But anecdotal report, this stuff is work good, and as I say, the good thing about them, they are very, very safe and they are effective.
So, are we talking about just one injection is necessary, or could you use one, two, or three?
You can use multiple injections. My experience for joint-related issues, usually one injection does the trick.
Okay.
Now, of course, your wear and tear doesn't stop, so you may have to come in on a yearly basis and get an injection, but that's definitely much, much better than cortisone injection. As you know, cortisone, even though it helps the pain, but it accelerates the deterioration of your cartilage. So they are good to help the pain immediately, but they are bad for you in the long term. You can also inject like the cushioning device in the knee, the hyaluronic acid, and they're very good, but they don't work on everybody. The plasma or the embryonic stem cell or the stem cell washout do provide good relief. We don't know yet if they are building new cartilage. There's some, I read some study that there is a new cartilage buildup found on MRI, but as I say, all those small study, anecdotal report, nothing 100% established. But yes, if it was me, I would rather use something that is safe and it doesn't hurt before I resort to
It's a great point, because people, what we see in physical therapy is shoulder surgery is at best, the rehab is difficult. I don't know of any type of rehab that's not typically painful and hard on the patient. So I assume that the PRP would be something that could work for a rotator cuff injury or a rotator cuff injury as well. Is that correct?
That is correct. That is correct. Matter of fact, some people end up having to have a joint replacement, and my goal, if I can delay that joint replacement 5 years,
Yes.
10 years, I've done you a great service.
Yes.
Because there's a time, you are replacing them with also a metal subject that is going to deteriorate over time. So these joints will last you a certain period of time. So if I can delay that, and instead of you having to have 2 knee replacements in your lifetime, end up with a 1 knee replacement or none, that I think I've done a great service.
Right. And the technology can change too. Like the shoulder replacement now, there's a reversal that seems to work maybe better than the old techniques, and you're counting on technology maybe to help in that
That is correct.
surgery going forward.
That
as
is
well.
correct. So the longer you wait, the technology is getting better, material is getting better, they're getting safer. So you be getting a better deal down the road.
I've got to ask you a question about that I get asked from time to time. There is COVID-19 is we're all dealing with that right now. They're talking about lots of pharmaceutical companies that are rushing to get a vaccine available to us. There's again anecdotal studies that show that there are certain things that may be prophylactically beneficial by taking it to help prevent it. But I want to talk to you about something called Metformin that is widely prescribed to people with diabetes. I have heard that with Metformin, it seems to show some sort of maybe a benefit to prophylactically with the COVID, but I've heard with anti-aging, it's also a drug that is being kind of tossed around as something that maybe. Do you have an opinion about Metformin?
So I don't know about COVID and Metformin. I have not read anything about what Metformin can be good for you as far as the COVID. But yes, for anti-aging, we have been using Metformin as an anti-aging drug for a long period of time. You have to realize a lot of time with the aging comes in the weight around the waist.
Yes.
You may not necessarily be obese, but you will notice that you have a little pooch or pack up more fat around your waist, and that's the natural aging process. You go from a V to a pearl. And that fat around the belly and also inside the belly with visceral fat is what lead to insulin resistance. Insulin resistance is the first step of you becoming a diabetic. Okay. Metformin works great in improving insulin resistance. So when you improve insulin resistance, you are decreasing the amount of time before you become an actual diabetic. Plus, help you lose weight. And we don't know if it has any life prolonging effect, but if you have decreased insulin resistance, that helps with pretty much every function of the body. So I use it a lot on my patients who are overweight, trying to lose weight, and you don't have to be morbidly obese. You can be a few pounds overweight, and if you're showing sign of insulin resistance, whether your fasting glucose is high or whether your insulin levels are high in the morning, a lot of time I introduce metformin. It's a great drug, has pretty much no side effect. The only people who cannot take it is people with advanced kidney disease. So yeah, I like metformin.
Well, I know that with metformin, you know, if you can lessen the insulin resistance, you're probably going to lessen inflammation in the body.
Absolutely.
Anytime you can lessen inflammation in the body,
Absolutely.
that's a good thing. And about the COVID stuff, I think more what they're talking about is again, anecdotally, they weren't finding people that were, so you have an underlying condition with diabetes, and if you get the COVID, they say that people with underlying comorbidities have a greater chance of being in the ICU, and that they were just seeing that people that were taking metformin for diabetes were never ending up in the ICU, which was positive.
Right.
Plus the fact that you know, just it's a kind of a natural drug. It's been around for a long time. We don't have to worry so much about unknown side effects because so many people have been taking it for a long period of time. We would kind of know.
Cheap and effective, and as you say, it's been around for a long time.
Cheap and effective. That's so the PRP shots and things like that. Since you said there were no FDA approvals for that, is that something we have to pay for a cash payment?
Unfortunately, yes.
Okay.
So none of the PRP or the embryonic stem cell extract are covered under insurance.
Right.
So it's a out-of-pocket expense.
Right. And you have a way for people to pay for that just here, and we don't have to worry about going through all the jumping through the hoops.
Correct.
And all that.
Now, a lot of people have a health saving account,
And we
they
can use that.
You can use a health saving account.
Okay. Because I know a lot of people have used that effectively.
Right. Speaking of a embryonic stem cell, I also remember the story of a personal friend of mine, and he used to be a football player.
Yes.
So as you know, these football players, they're strong, athletic, and big, and they feed them a lot. But once they stop playing, oftentimes a lot of them put some weight on. So the combination of weight plus all these wear and tear from playing footballs, he does have some not so good joint and have some knee issue that given him some mobility issue. So he said, Fadi, I'll do anything. I said, okay, well, you know, this is a PRP, it's not approved. He said, I'll try it. So he did, and he did it about 2 years ago. And he said that my knee never felt any better.
Wow.
He said, I don't know if it's a placebo, I don't know what you put in there, but I'm telling you, I have not felt better in terms of my knees not hurting in years. And he wants to come in and do another injection. So I have a lot of those anecdotal. I wish we will have more data that show how good these things are, and have a more standardized protocol, so we can get the insurance and Medicare to pay for these things. Because I think it will be a lot of benefit for a patient for the future, as I say, for delaying knee replacement and give them a better lifestyle. And
Well, I have a lot of problems with the way our FDA works in this country. It's very slow sometimes on getting on board with, and it just seems like that if the insurance company, Medicare, is going to pay for a knee replacement, which is a fairly substantial amount of money,
right.
Why wouldn't they be interested in paying for something that would be either preventing the knee replacement or at least allowing the person to have a lot longer
Right.
quality of life before getting it at a cheaper price?
That's a different discussion altogether. The problem is there's no randomized controlled placebo study, and nobody's willing to take the initiative on that just because of the cost associated with it. And sometimes these big institutions that do those studies prefer to keep it as a cash pay because
Sure.
they can make more money, I guess, not doing it. But that's a whole discussion. As I say, I always me and my colleague physician that we talk about, we wish that they will do a something that more randomized. It also help us because it will have at least standardized protocol. Because right now I use something, you go to another clinic, they use something else.
Right.
I use a certain amount, another clinic will do different amounts. There's no randomized protocol.
Well, it sounds like you're on the cutting edge right now, and it's hard to find a forward-thinking physician that would venture out onto that, cutting edge. Is there anything you can tell me that you're excited about that's maybe coming in the future that we could look forward to in the next few years in the topic of anti-aging?
Yes, I think stem cell therapy it will be huge. Once we be able to extract pure stem cell and be allowed to inject those without calling it a stem cell manipulation, I think that will provide a greater success rate and more guaranteed result, and then you will see more approval from third-party payers. So I'm excited about that prospect because we'll be able to not just take care of joint disease, we might be able to help regrow skin for people having skin ulcers hard to heal, might be able to grow new blood vessels.
Wow. Nerves.
Maybe nerves. There's a lot of research going into that. But I'd say that right now it's still in the baby stage, and I just hope some of that restriction will be lifted off, and that field can blossom.
Right. Do other countries, Europe, places like that, are they farther advanced than we are in regards to that?
Unfortunately, yes. You hear about athlete Kobe Bryant, for instance, that went and got a stem cell injection in his ankle, but he has to go overseas.
Mm-hmm.
So I hate for us not being on the frontier of doing something like that. And I know if we have the restriction lifted, that we will excel. And the beauty of this country is the amount of research and manpower and great mind is there. That if we have some of the restriction lifted off, we'll excel and supersede any other country by far. Right now, people go to Japan or go to Caribbean or somewhere, and I don't think anybody can provide better service than the USA.
I know, and I hear of these doctors who will consult you on stem cells, and then they say, "I'll meet you in Costa Rica."
That's right.
That's where we're going to have to do it.
That's right.
So
I'll much rather for them to meet me here in Lexington, Kentucky, and I'll be able to do these things, and we'll have our FDA backing, we'll have our insurance backing. I mean, that field could be limitless.
What about for, we talked a little bit about hormones. Women get older, they go through menopause, sometimes they need hormone replacements. Men, as they get older, I assume their testosterone levels start to decline. Is that something you talk to your male patients about, is testosterone or anything?
Not just male and female. So the aging process, as I talked earlier, you change your V shape, your muscle mass decrease, your mobility decrease, and then your hormone go out of whack. So not necessarily decrease in hormone, but sometimes they become imbalanced.
Okay.
Also, our life is stressful. You're always on the go. Your cortisol level might be messed up. Cortisol interact with all the other hormones. So you may end up with an elevated cortisol level, decreased testosterone, or female you may have an imbalance between estrogen, progesterone, and cortisol, and all that will make you feel tired, fatigued, give you sugar craving, make you gain weight, and then lead to a disease. So and then you start fighting disease, you have to take medication, side effect, and all that. It's just a vicious cycle that keep on, and so that's why a lot of patients will come see me is I'm not feeling it. So what I do is I start with first a comprehensive question that I created, as far as their sleep habit, diet habit, exercise habit, work, what they do, how much alcohol they consume, how much sleep they get at nighttime, and those kind of things. Different from person to person. And then I do a battery of testing, not just to include hormone, but I test everything in the body because everything works in harmony. Thyroid, diabetes, insulin resistant score. I do advanced lipid analysis, not just your typical cholesterol, LDL, HDL, but I look at the particle numbers as well. I do a lot of inflammatory markers. Check for inflammation in the blood vessel. Check on inflammation on thyroid that could indicate that you probably have inflammation going on in your body. As you know, oxidative stress or inflammation is one of the major factors that make us age.
Right.
You have a person with no stress that will look great, and the person who have stress will look like 10 years old.
Yeah, identical twins. I mean, you
Could be, exactly.
Yeah.
So, so I do all that evaluation plus the hormone, and then I'll sit down with them and see what their goal. If the goals are irrational, then we'll probably will not have a relationship.
Right.
If the person have a rational goals and they're willing to work with me, which 99% of my patients are always usually eager to work with me, then we establish a relationship and then we work on it little by little to fix it. If the person is looking for a quick fix, it's not gonna work. And I tell them I'm not gonna be a doctor. And I don't assume so they'll have their physician and they'll continue to see their physician. But I'll be on the side monitoring, so if they, end up with any new medication, I'll monitor and see if we can avoid some of these medication or if we can reduce the dose. I have a patient that he was taking 2 blood pressure medication when he came to see me, and he was feeling terrible, a lot of joint ache and so on. So now he's taking 0 blood pressure medication, and he is feeling great. I'm not done with him yet. He's only been with me for about 4 months.
Okay.
So that's a process, and we just work on issues as they come along, and some existing issue little by little. So we go back to the hormone. Testosterone, for instance, is not only male hormone. Most females become also testosterone deficient as they age. That's why their body mass and muscle mass decrease. That's why their bone density decrease, and they need a little bit of testosterone to help them with libido, help them with workout, and then help them with maintaining a healthy weight. Same thing with men. And then on top of it all, we also look at growth hormone. So growth hormone has been called for years as the fountain of youth.
Sure.
But use of the growth hormone itself is a frown upon. It's expensive. If you don't have growth hormone deficiency, it's not indicated in the medical literature to have any growth hormone replacement. Growth hormone will make you feel great, increase your performance, reduce your aging process. But it also comes in a side effect that sometimes can make you have some joint ache or retain fluid, or most important, if you have a hidden malignancy, it's a growth hormone. So it's gonna make that hidden malignancy grow faster. It's not gonna cause cancer as far as we know, but it will make the cancer grow faster. So now there's a lot of a peptide they can use that stimulate growth hormone. So it raises it up a little bit. It doesn't make it, a super natural, super normal, but it will raise the level enough where you will get a low kick, reduce the aging, help you with tremendous sleep, and help you leaner. There's one peptide called MK66 that did a small study. They give it to folks between the age of 18, I think, and 70. They noticed within the period of time of that study, without any change in diet and exercise, people became 2.3 pounds leaner on average.
Wow.
That's just without anything. So, that stuff is good. It's still, kind of expensive. It's not as expensive as growth hormone, but I use it in conjunction on the appropriate patient.
Is that like Osterine? Is it like a SARM? Is it like a SARM specific antigen receptor molecule?
No, they're peptides. So the peptide is like a amino acid sequence. Simulate the growth hormone releasing factor to an extent.
It's like a precursor almost.
Yeah, that's right. So and then help pituitaries to secrete more growth
So it's
hormone.
a natural way. Your body secretes the hormone.
That's right. So you're not getting actual growth hormone. You're just getting a stimulant that stimulates your pituitary to secrete growth hormone.
That's pretty impressive.
Yeah,
I think most people.
The term for it they call secretoral log or secreting peptide. But there's multiple form out there, and I use those usually with cautious. I mean, I do them in short bursts, and as I say, it has to be an appropriate patient. And again, a disclaimer: none of that is an FDA approved.
Right. Well, I've got one thing to say to the viewers out there is put a pin in this one because I want to work with Dr. Bacha because I've got a rotator cuff issue.
Right.
I would love to try the PRP.
Yes, and we can do it. We can do it live. You want to shoot a video and see how it
yeah,
goes?
because that would be a great test case for that. And then we're going to do a separate podcast where Dr. Bacha talks about his Vein Institute here, and we'll cover some of the vein issues that people experience and how you can help those as well.